Hi, this is Dr. Michael Rothman, and in this video I want to talk about chronic fatigue syndrome. What is it, and what can we do to fix it? First of all, chronic fatigue syndrome is just a name given to a syndrome where the patient is tired all the time. The name itself doesn't really tell you what's wrong, but there certainly are things causing chronic fatigue. Now, if you go to your regular doctor, he or she may say, well, we don't really know what causes chronic fatigue. It runs in your family. It's all in your head. You're too old. You're too fat. They tend to want to blame you for this syndrome. They may even want to put you on antidepressants or some other type of drug to deal with the chronic fatigue. The thing is that, in my experience, chronic fatigue almost never occurs in a vacuum. In other words, there's always other symptoms involved. There's usually some sort of irritable bowel syndrome where the patient's having gastrointestinal symptoms. There's oftentimes headaches. There's oftentimes aches and pains in the joints. There may be sleep problems. But there's always other problems. There's hormonal imbalances involved. There's mood problems involved. These are all related. And so the key to treating chronic fatigue syndrome is trying to find out what is causing the problem in the first place. Now, let me give you a couple of examples in my clinical experience that I have found to be underlying chronic fatigue. Some people, because of the way they're wired, because of their constitution, they tend to be very anabolic. The anabolic patient tends to be very sleepy all the time. They tend to be depressed. They tend to be constipated. They tend to urinate quite frequently. And these people will have a sleepy fatigue. It's almost like they're walking all day in mud. They often complain of brain fog. Now, the exact opposite end of the spectrum is the catabolic patient. This patient tends to have diarrhea, tends to have anxiety, tends to have insomnia, and it's more of a burnt out fatigue as opposed to a sleepy fatigue. So even though they're tired, they're not really necessarily sleepy, and when they do sleep, the sleep is not very restorative. Additionally, a very common cause of chronic fatigue is undiagnosed hypothyroidism. Thyroid disease is very, very poorly diagnosed in the mainstream for many, many reasons, and I'm going to talk about this in a separate video. But let me tell you that it's so common, it's ridiculous. So if you are suffering from constipation, sleepiness, depression, you're cold all the time, you're losing your hair, your eyebrows are getting thin, you have all the signs of symptoms of hypothyroidism, and you've been to your doctor and your doctor says, oh, it's not your thyroid because all your tests are within the normal limits of the lab. Just because your TSH and your free T4 are within the normal limits of some laboratory does not mean that you're not hypothyroid. I've seen hundreds, if not thousands of patients in my career that were told that they were not hypothyroid, and yet they were. The single most important thing when it comes to your health is your diet. So let me leave you with two things. If you do suffer from chronic fatigue syndrome, there's two things that you absolutely must do. Number one is you must stop eating all sugar. Sugar is so poisonous, and it will mess you up in so many ways, it'll make your head spin. Number two, you need to avoid eating fried foods and vegetable oils. These oils are very, very toxic, and no matter what kind of imbalance you have, they'll create an inflammatory response in your body, which can lead to not only fatigue, but also a lot of the other symptoms that go along with chronic fatigue syndrome. And lastly, you need to make an appointment with me. Call my office. I will test you. I'll test your anabolic catabolic balance. I'll do lab tests to look at your thyroid. There's a lot of other things that we need to explore: your hormones, your diet, your nervous system, your immune system. These are all interrelated and all part of the problem of chronic fatigue. Well, I hope this is helpful. Have a great day.